like, because we have a couple Rachels, and one's really, really quiet, and I never see or hear from her. She probably is doing amazing things behind the scenes. And then we have you, and I'm like, okay, we're recording, you guys. We got lunch. Yay. I felt so much better once I had food. Um, I will watch for anybody else to come in. So this is our first quarterly evaluation. I mean, that's a fancy way to put it. So the first thing, I have some notes here because you guys know me, go ugly early. So I was like, wanted to prepare. I wanted to get my iPad so that I could share my screen and draw stuff out on my iPad, and it never happened. So I'm like, I'm just making some notes and we're going with it. First, I want to go over why I decided to create these. So I got the idea from one of my business classes that I'm in, and I love it because I'm the person who, when I have an accountability group, or I'm the person who shows up at the gym when my personal trainer is there, because A, I've paid them, and B, they expect me to, so accountability is great. Also, because other than Friday coaching, which not everybody comes to, or just kind of, it just varies. It gives us the opportunity to have live interaction, to meet each other, to support each other. That's one of the big things that when I talk about what sets my program apart from others, I always say is there's like the leadership from me, like I don't love you and leave you. Like a lot of programs do, you get to the end and it's like no further support, but I don't feel like I'm successful until you're successful, whatever that success looks like for you. And so anything where we can help support each other, keep each other on track, and also just see faces. You guys, I work with people around the world and they're just my clients. Like I don't go out with girlfriends. Like you guys are being my girlfriends today. It's like having coffee. So that's why, is just because I wanted more time of a live component, but I also want it to be useful. So in my course, in my business course, when they were doing it, I thought, I'm going to do that with my ladies. So that's why we're doing it. So here's kind of the lay of the land, how we're going to do this. I just have an hour to be here. So I'm going to talk quick, and then we're all going to just kind of, I've got a couple. I have Cindy, who does not have a quarter behind her. And I have Erin, who doesn't have 24 hours behind her since she enrolled. So they're just here to watch and learn and see, what this is about, having essential priorities, that kind of stuff. So I'm going to just talk about that for a minute, and then I will lead with how I did this. I have my notes. I'll lead how I did the last quarter. So for those of you who remember from the course, I teach about, you have your annual goals. And if you really take your annual goals and you break that down into quarterly goals, monthly goals, weekly goals, and like in my case, or daily goals. My case, since I'm full-time doing this, I feel like I have more, it really matters to break those down into daily goals. Sometimes I don't so much because I have my weekly goals and I'm just trying to get my work done, for the week, so I don't, it's like, oh, where did I get to yesterday? Okay. So that's the biggest thing. So a quarter is 90 days. So in the course, I talk about your 90-day essential priorities. So there's things that you got to be doing as you're going through the course. Cindy, Erin, this is going to be new to you guys, but very quickly you're going to be learning. Like I'm learning Myo. I also have to start talking about it, letting people know, like, I can help you. Maybe not today, maybe not tomorrow, but like you have to be having conversations. You also start thinking about your business. So there's a lot of things. And so everybody's essential priorities are going to be a little bit different. If you're new, a website should be one of those, but also you could build a business without a website. I think it's 2024, so it's really important, an important piece, and it's a great tool for you. So the three essential priorities are just kind of those things each week. When you look at your calendar, you guys will go through the total calendar control program lessons. So you'll kind of learn laying out your calendar, that kind of stuff. But what it does is it just helps minimize oh my God, what do I do? What do I do? Christy
Mhm.
talked about it in coaching this morning, how when she went through the lessons, if she wasn't getting everything done, she made a list. So she knew that she had stuff done. And so, so everybody's going to do that a little bit different. So what we're going to do in these quarterly evaluations is basically each person will take a turn. Hey, here's what here were my goals. This is going to be a little bit iffy today, but next time you're going to know, ooh, I got to get good with focusing on what it is that I'm working on, so that if, when I meet, I can say my essential priorities were this. Now, if you get other things done, if you get that all done, you add something else to the mix. But so that's why it's going to be kind of iffy today, because myself included was like, okay, what exactly were they, and I had to think on it for a minute, and then I remembered them. Okay, so we're going to go over what they were. So you're going to tell me your three, or you're going to tell the group of ladies what your three were. Then what worked, what didn't work. And then the last one is what you're going to do differently. So some things are going to work seamlessly and wonderful. Some things you're going to fall on your face with it. And then it's like, oh, it's just information. So remember, in business, nothing is good, bad. It's just like, it's data, it's information of like, whoa, I did not do what I said I was going to do, or I did it and this didn't work. And here's what I'm going to do different. Is that clear as mud, you guys? Okay.
Yeah.
So I'm going to go first. So I had 3 essential priorities, which again, remember, comes from my annual goals. When I plan my year, then breaking it down per quarter. Sometimes these are driven by revenue goals, just different growth metrics. So everybody's going to be different. So I had 3. One, I wanted to plan live workshops. So for for my myofunctional therapy business, like, I'm always looking for a way to stand out. As you guys explore social media, you're going to see like there's just so much out there. Everybody's saying the same thing, so we're educating different people, of course. But I want to plan some live workshops so that I can help educate, whatever, if it's parents. Hey, I have taught workshops like don't raise ugly kids. 6 things parents should know, that type of stuff. So I wanted to do that. Okay. I wanted to get my memberships done. So by membership, meaning I have a couple different programs, Mighty Mouth and My Oh My Way, which are fully 100% digital. I wanted to get those up and going. Those are passive income for me. Is it my ideal audience? No, because my ideal customer does therapy with me face to face. I can see their smile, they can see mine. It's not in the cards for everybody. $5,000 for a year of therapy with me, and somebody's in Pakistan, that's not going to be an option for them. So a monthly membership is. So my goal was to get those done. And then my third one was to fill Jessica's schedule. Jessica is my associate. Okay. What worked? I got the memberships up and done. And welcome to business. I'm now moving them because they drip. So for those of you who don't know what it means for something to drip, it just becomes available at a certain time. So they get a new lesson every 2 weeks. I can't have a year-long program that drips every 2 weeks if the platform suddenly makes a change that you can't drip past 60 days. So I'm moving it. Okay, so I got that done. I just now have a hiccup. What didn't work? Planning the appropriate amount of time. Who has this problem so far? They think they can get 10 hours of work done in a 4-hour time spot. Am I the only one? Yeah. So that was what didn't work for me. So I overplanned. Okay, so it's like I got to get this stuff done, have this many tasks, but I didn't take into account the hours or I didn't realistically plan how long it was going to take. Let's put it that way. And then, okay, so what would I do differently? Plan less than what I think I can get done in a day. So what I've been really working on is, if I have something that I think is going to take me 4 hours and I have, a 2-hour task and I've got like 5 hours, I'm obviously going to work on one task. So it's getting better. And you guys who have been through total calendar control, like this is a work in progress, and we all have seasons where we're better with our time. I just have to really get better at quit thinking I'm superwoman and that I can get everything done. Okay. So that's one thing I'm going to do different in the next quarter. And then plan my year out with more white space. So it's that time of year. So this quarter, each year is when I start thinking about business next year. I start looking at revenue goals. I start setting my calendar like I have already blocked out vacation days, those type of things. I've started looking at, okay, well, if I need to or want to earn X amount of dollars, how am I going to do it? So I kind of back into that. I used to do it the last 2 weeks of December. So the lesson in the course is the end of year workflow. And that worked for me for a long time. But now I've kind of just gotten to that point where I need to do it a little bit sooner. So we started that for this right now, the end of September, the first week of October. So that's what I'm doing differently. And I'm planning more white space. And by more white space, meaning what I think is downtime, because I know something will get put in there. And then last, being consistent. So I talk to you guys a lot about being consistent, and it is so very, very important. And in this year, since I've had the health challenges with my daughter and stuff, I have found my consistency coming and going. Or it's like, oh, I'm taking vacation. I mean, I just took off most of September and now I come back to work this week and I'm like, but I don't want to send an email, but I don't want to do anything, so consistency, practicing what I preach, is a biggie. And also we're doing some testing with that consistency, like what, not just my thought, but looking at data, looking at metrics. What happens to my growth when I post every day? What happens to my growth when I post every few days? What happens when I post carousels versus this, so consistency is key with that. So that's my plan. I'm going to get better with that. So I'm going to keep these, and I encourage you guys, in the future, when we do these, have somewhere where you put this so that you can bring it next time. And I can say, okay, when we were here last time, here's what I said I was going to do. Now, when we meet again for this, it'll be the beginning of January. So it'll be wrapping up Q4. And it's just a weird time of year because you're always like looking back at the year, but you're also looking forward, which is so exciting at that stuff. So that's my plan, is I'm going to hold myself accountable to this. Like, okay, this is what I said I was going to do. Okay. Any questions, comments? Anybody else feel the pain that I'm feeling? No? Yeah. Rachel's like, not enough hours in the day. Right. Okay. Who wants to go next?
I'll go.
Go for it.
So what my goals were, I wanted to get my brochures completed and done and printed and delivered, and I did that. And then along with that, I went and I visited 2 doctors who do the frenectomies and trying to create a relationship there. Introduced myself, gave them my introductory packet, and when I did that, it was really exciting because there was a 1-month-old getting a frenectomy and a lip tie release. And he's like, you want to watch? And I was like, yeah. So I got to see that. And it was really cool because I saw my son get his done. And it was different because when my son got it done, he was 5 days old and it was just like a little zip. And then this baby, it was like the real deal.
Yeah.
So it was cool. And then I also saw my son get his second release done, but as far as the baby goes, it was different than my first experience watching.
And now you see that connection between you know, when people say, well, Johnny had a release when he was a baby, and you're like, yeah, and he needs my help now because I know. I mean, I tell
Yeah.
you guys this in the course, 100% of my clients that had a release when they were a baby needed it again. 100%. I haven't had anybody yet who didn't.
Okay.
So
Yeah.
that's why, is because they have a little snip, snip, and it's all about the breastfeeding relationship.
Yeah.
So now you have that anecdotal story to go with it.
Right. What else have I done? I got my website done, and it was through GoDaddy, and they're like, yeah, we're working on your search engine optimization, and we're doing all this stuff, and then nothing was happening. And so I had to go to GoDaddy and have them like reset all these settings in my website. And when I was doing that with the person helping me, I thought I was getting punked. There was so much that needed to be fixed within the inner workings of my website that I was just like, what have you guys been doing the last few months? And then since we did that, I've actually got some hits. So I've gotten 2 people to contact me, and I've had 1 free assessment. And then I don't know, I'm supposed to have a comprehensive exam today, but I haven't gotten the videos, the pictures, the paperwork, and we're in the money
So
for
how'd
his
that happen?
comprehensive.
How did somebody get the opportunity to schedule a comprehensive exam without paying you?
I scheduled him a week ago. So, I mean, yeah, I'm not doing these things correctly, but I
But you're
scheduled
learning.
him.
You're
Yes. And
learning.
I'm not upset. I'm not upset because I know all this stuff. Like, I'm working full time. So the money's not scarce. It's not in scarcity mode with money. I'm taking all this as learning experiences. So hopefully after his free exam, which I thought went better than the first free exam I had, um, I know that I can help him. I know he needs myofunctional therapy. And I let him know that. And I said, so I scheduled him, and I said, okay, I'm going to send you an invoice. And these are the emails. And then I said everything that he needs to send back to me before his appointment.
Nothing.
And I'm hearing crickets here. So I don't even know if he's going to show up. But I even said we can reschedule if you're not ready. Because I'm not going to see him. I'm not going to make the mistake of seeing him because he hasn't done the work, nor has he paid me, and I'm not going to work for free.
Yeah. Yeah. So, so what has, well, so you told me the 3 things. So what has worked? Obviously you set some priorities and got it done. You got your website up, you got
Yeah.
your brochures done.
Yep. And I did my visits to the doctors.
Oh yeah. Yep.
So,
yeah.
yep.
So that is great. And so those were things that you set out to do, right?
Yep.
Okay. And so what hasn't worked, or what do you want to do differently?
Oh, the way that I'm dealing with invoices. And because I do have a client right now and he hasn't paid me yet, I know for 100% he's good for it because he's a patient at my office. But I've been a chicken about being assertive.
Yeah. So how can you change that, or how do you want to change that?
Well, in the future, I'm not going to start therapy without payment. I was just happy she's my first client. I just was like, let's go. Come on.
We've all,
So,
you are not
totally
a unicorn, sweetie. We've
I
all
know.
done it. I even have mailed a damn kit before somebody paid for therapy, and then they backed out. She was decent enough to pay the postage to send it back, which most people wouldn't even do that. But it was like, okay, don't have to worry about that ever happening again. So I put no effort, and it's hard, but those boundaries, and remember, you want to get your systems in place and stuff, because you should put no effort or very minimal effort into somebody, like, nope, pay for an exam. So when I have somebody who's paid for an exam, I had somebody recently paid for an exam. She did 0. She didn't send me anything.
What do you do?
For that spot. She showed up and I said, hey, did you send me everything? She said, no, I didn't get around to it. Do you want to reschedule? I said, nope, this is your hour. So we're going to do the best we could. So we talked. I gathered data, things that I needed to, like doing the functional assessment, that kind of
Yeah.
stuff. Because basically I was working on my report, and then I said, once you send me the pictures and videos, now we're going to put the cart back behind the horse. And I thought for sure, because what happens is most of the time they just never send anything. She did. And then I wrote my report, so you got to get enough information to write your report, which is easy.
Yeah.
And she accepted therapy, and now we're rocking and rolling. So in that case, you'll get to the point where you're like, oh, you paid for this spontan therapy. If they no show, unless their house was burning down or they were in a flood or a tornado, like, sorry, like you had that spot in my schedule. So it's not a mistake because you learn from it. And then you're like, ooh, I'm never gonna play bill collector. And that's the thing, is like nothing. Like if somebody, and I have shared this in the program, if somebody, if I'm making them a custom appointment, like if they look and I don't have an exam appointment until 3 weeks from now, but I'm agreeing to do it tomorrow at 2, I will tell them, go pay for the exam, book it on any old day, and I will manually move it, and I'll see you tomorrow at 2 or whatever. And if I don't hear from them, okay. So,
Yeah.
But those are all good things. Good things.
Mhm.
The thing with the website, it'll happen.
Yeah, I mean, these 2 people recently, actually 3 people have contacted me from my website, so I know people are seeing it.
Good.
So I think we're good now.
Yeah.
But
Well, SEO is a nonstop thing. You constantly have to be working on that. All content, all content that goes out there on social media, like even I'm paying attention differently how I'm writing content. So I've got keywords in it. I'm paying, like hashtags are kind of changed up, so that kind of stuff just helps bring people there one step at a time.
that's definitely something I don't know a lot about. So
Yep. One
makes
thing.
makes me want my head explode. I'm just like, I don't
Then
know.
the nice thing with our industry is like, you don't have to think really hard, Rachel, about keywords when you're thinking about writing something about mouth breathing. So mouth breathing is going to be your keywords. It's harder like in business or nutrition or something like that because it's just
Okay.
so saturated. But yeah, one step at a time. Okay, perfect. Let's go. Who else wants to go?
I can go.
Okay, go for it. What were your priorities?
Networking with local dentists. I had some materials I wanted to drop off in person. I got that done. And I actually got a referral from it. I wanted to have 2 specialists within 4 hours of me. And now, like I was saying earlier, I have them both, like one in Texas, one in Oklahoma. So I feel good about that. I've talked with one of them on the phone. The other one has sent me a thorough email. So now I feel good that like I have that relationship established. And the clients have been happy going there too. It's, they feel like it's a comfortable place.
Good.
And then I'm working now on social media, and I'm trying to, follow, like start the blog, take the content out of the blog, like you had suggested. And so I'm trying to get just consistent on that because that had really been on back burner. All my clients are coming from people I know or people who have met in the dental chair. And I really want now to start building the online presence and it have anything to do with location or having met me face to face.
Awesome. So what worked?
The drop-offs did work. I don't know how well. I've had one client, but that's at least I know that they paid attention. They had never even heard of myofunctional therapy when I dropped it off. So I thought that was good.
That's a gold mine. If they've already referred to you, now you get results for that client. And
Yes.
you're going to be like Kelsey has that amazing referral source. So that's good. That's good that they had never even heard of it. And then they're like, hey, I'll send you somebody. Good.
Yes. What else? Oh, and then, so I initially sent letters to the 2 providers that I wanted to work with, and I didn't get anything back. But then once I sent a client, then they sent me information. So if you send your introduction letters out and nobody responds, don't take it personal. Once you actually get someone in their door, then they'll start communicating with you.
Yeah, because remember, they're running a practice, like my provider in South Carolina, he's like, Carmen, I have 4 boys. And, because I got after him once about not reading my report. And he's like, your report is like 8 pages long. I run a dental practice and I have 4 boys. Like, come on. Okay, fine.
So I would say that's working.
What didn't work?
So far the social media, I would say, isn't necessarily, it's not that it's not working, but no results from it yet, or no like tangible results from it.
Okay.
And I have let one client go per session. It's not backfiring. They're showing up and they're doing the work, but you definitely see how, like, I'm right now, like, my goal by the end of this year, I want my investment paid back. I'm like, let's get this done. You're never going to pay back your investment if you're doing per session. And I know that's why you teach that, unless you're finally so busy that you're stacking them. But it's also not what you're teaching, is like run yourself ragged. You're trying to give yourself some space and some relief, like dental hygiene, you're bam, bam, bam with patients. We're not trying to do that here. So I necessarily wouldn't say it's not that it's not working, but I don't know that I will continue doing it regardless of like if I get burned by it or not. I'm just kind of on the fence. I'm in the demographics here, like there's a big need for the kiddos. A lot of them are on Medicaid. And so I have a heart for like people who really want the help, but they don't have all that money up front. And the software, so I should be changing into payment plans soon. The software I started with lets me under 10 clients. It was a really small monthly fee, but I don't have the payment plan option. But now after 10 clients, I will have that option. And so it was kind of for me too, of like, I'll try it. We'll see how it goes. It lets me get some experience. And then once I'm bumped up to that tier, then it's a payment plan or a pack or a pay in full.
Yeah. Yeah. And Christy and everybody else, there's no right or wrong. Like, I teach you what I think is best practice. And you can see why, it's hard to scale your business or even pay yourself.
Mhm.
Like, I need to pay myself, $5,000 a month. I need people to pay their bill. And if people are coming at me one session at a time, so my friend Kimmy, she put it very well because she, at least, I don't know now, but at the time when she told me this, she said, I'm doing per session therapy because that's her idea of a payment plan. And I agree with that, but I also don't, because they don't have a commitment there. So like renting a car versus having your car payment is totally different. So now I have had people where I have had to extend their payment plan a little bit. Like, obviously I'm never going to, if I'm in therapy with somebody for a year, I'm never going to go beyond 11 sessions or really 10. But I have had to extend that for some people just to make it manageable. Or you can always get creative. Could they give you a larger chunk money down, that kind of stuff. So it's your business, you get to decide, but just long term, it's just difficult to see the light at the end of the tunnel for you to, to be able to retire from hygiene or,
Yeah.
But also I just know that people long term, after thousands of clients, and I say this all the time, sadly, people are quitters, and I even have people who pay and they like, oh, it's just too much for me right now. I'm like, oh my gosh, I go to the gym because I pay for the gym membership. I go to the car wash because I pay for it, so the thing with social media, so just that consistency, kind of like I was talking with myself. The one thing that I will tell you guys, so Christy was saying, like, I teach, you write a blog and you reuse that material. When you're writing content, write it good, write it thorough. Don't use, my business coach was beaten up on this today. Don't use big words. So I need to start watching that, because I know sometimes I use industry lingo and the lay public doesn't want to hear frenectomy. It's like release or whatever. But write it good because you're going to reuse it all the time. You guys know me and my Trello boards. So put it on a Trello board because that will help you with your content being consistent. Not only do you have that for the blog, but then when you go to just make a snippet and as social media things are coming, they got to be shorter. I have trouble writing short content. It's so hard for me. And my team's always like shorter, 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 a 5-second video, a 7-second video. I'm like, I can't even say my name in 7 seconds. So that's difficult. I think you covered everything, Christy, right? What's working, what you want to do differently. I don't think you talked about what you want to do differently. Is that just be more consistent with social media?
Yes. Yeah. Is that also like goals for next time, or we're not doing that yet? Or goals for next?
Well, and that's a good segue into like what really, if we were following the plan, your goals for next time, you would technically already know because you would have had your big umbrella goals, your annual goals, and then your quarterly goals. But sometimes it doesn't work that way, so probably what you were going to tell us, for your goals next time are probably, or I should ask you, are they falling under like that kind of cascade of your goals? Does that make sense?
Yes. As I look back, I see that I never broke them down into quarters, but I can see all the goals that I just had for the year. And it did make me tear up actually when I got on. Cause I'm like, I did that. Like I said, I'm kind of obsessing right now over like, I got to get that paid back. I got to get that paid back. But I hadn't taken the time to look at like some of the things that I did that I wasn't sure I'd actually accomplish, I guess, like in a year. So that's really cool to me to see like, oh, I wasn't sure about those providers, that really like makes me proud that I've done that in that time. And then, I don't know, there was a few other things I saw in here that I'm like, oh my gosh, I did that.
Yes. And you have to celebrate you because, and I have talked a lot about that this year. I just got the goosebumps again. You guys are like making the hair on my arms grow today. I've talked a lot about that this year because with the health of my daughter, it has been the time where I really sit back and go, I am so proud of this thing that I built that I can pick up and go to be with her during her cancer treatment. Because I never celebrated me. I celebrated when I paid cash for the Forerunner. That was pretty exciting. But I mean, in the day-to-day stuff, it's like, oh, got that done. Oh, I got that done. Oh, I got that done. And I'm just plugging along. I never look back and go, proud of myself for that. And it wasn't until this year where I thought, wow, this is really cool that I'm able to do this. So it's those little things because yes, you want to have your investment earned back. But you of anybody, I can really say like you have really put your systems, your processes, everything in, you've taken things slowly. You've had your own things going on. And so you can't drive a parked car,
Right.
So you've just had your car. I mean, it might've been in neutral at times, but you were going and you were working on things. So you just want to keep working on that. So now going into, a new year, then you start thinking like for 2025 and for everybody else watching, you're thinking, okay, what are my goals next year? Okay. So if your goal is 60K, I want 60K of therapy. Okay. What's that per quarter? What's that per month? No, it never works out that way. I can tell you that right now, because every year I do this. Okay, my goal is, 300,000, which I never set my goal that high. Whatever, we'll just use that number. So 300,000. So that's 100,000, or no, that's not even good math. Let's say 400,000 and $100,000 a quarter, so you break it down. Then you break it down into, you have to look at a couple things. Think about how much time you have. And if you want to hit that goal, do you need to raise your prices? If you can't work with that many clients, maybe you need prices a little bit higher and you have a premium practice, that type of stuff. So that's just kind of how, but it's not always just revenue. It might be, getting additional stuff on the website. In Rachel's case, she might be saying, hey, I'm going to just really get a better understanding of this SEO stuff. Rachel, you'll never master it all because none of us will. You can never chomp that whole elephant. But that's what you do. Okay, Emma, your turn. Are you gonna go?
Sure.
Sure. Because I want to know if you've met with your friend yet.
Oh yeah, I have met with her and we did compare notes, and we're planning on, she hooked up with a girl around here that is a myofunctional therapist. I'm not sure if she's a hygienist or not, but she's doing like a lunch and learn at a orthodontist here in town that's supposed to be airway focused. I'm not really sure. I've never really looked into her practice, but she wants me to go and just hang out and see what it's like. But yeah, I don't know. I could never see myself doing that. I don't know. It feels very scary. Anyway,
Doing a lunch and learn.
yeah, so it might be good to just see like how it goes. But there's going to be a lot of other providers there, like
Networking.
yeah, that's what I'm thinking, like who she knows in the area, and yeah, like chiropractors and things like that. So yeah, we're thinking I'm gonna do that and see. But I've never met her either, so maybe to meet her would be cool. I don't know what
Awesome.
training she's done. But
All
I
right.
think
What
for
were
me,
you?
my 3 things, the social media thing is big for me. I think it's very scary to put yourself out there for me. So that's going to be very challenging, but
Okay.
something I need to work on for sure. Changing over from the bronze to the gold, I've been trying to utilize the swipe files and really get the introductory pack, all that stuff, policies and all the paperwork stuff.
Okay.
And so the brochures, maybe introductory packets. So those have been on my list. Also just really practicing my message, like getting the message down. Sometimes I feel like I still, I don't know, when I talk about it, maybe not fumble with what I want to say, but almost like talk myself out of them needing like myofunctional. Well, maybe you could see your ENT, or maybe, I don't know. And
Oh,
I know
that's a gold nugget.
patients that are like in this area, a lot of the big oral surgeon person that we refer to for TMJ, they are no longer doing it. They are like, oh no, we don't do that anymore. So they're referring out to who knows where, like these cities that are farther. So I don't know, something that I need to work on, the message thing. And also I'm super close, like an hour away from Dr. Zaghi. So I'm sure that is something I need to explore. And yeah, I mean, without traffic, an hour away. We have a lot of traffic where we live, so it's far.
So it's like 5 hours with traffic.
Yeah.
Oh, okay. So what has worked? So if those were your priorities, what has worked?
Yeah. I wish I could say more has worked. I feel like I just really need to get out of my own way.
Get out of your own way.
Really.
And that's what these are good for. And that's why I said this will be a little bit iffy this time, because you guys will know for next time, everybody will come in like, these were my 3 priorities. You're going to know, like, come January, I want you guys to be able to say this is my goal. And we want it to be realistic. We've all talked, I've talked a lot about it. Everybody wants that 6K a year. Like I had my first year, but it's different for everybody. I wasn't raising kids. I was working 312s. I had some more time, that kind of stuff. But just coming in of, maybe it's like, Christy saying, hey, I want to have my investment paid for. So doable. But when we meet next time, then it's like, hey, these were my goals. Because now, and I thought this was how it was going to be. And for me, it was the same when I was kind of figuring out mine. It was more like my to-do list, what I have gotten done. Because what I have gotten done and what you guys have gotten done isn't necessarily success on our essential priorities. Does that make sense? And so we just going forward, we just want to be thinking about our true north, what that is. Like, next week when you sit down with your calendar, it's like get better and better. But come January, like we got to all try and be bomb diggity, like this is what I'm working on this month, this quarter, these 3 months. So when I sit down and look at my to-do list, everything should be going to that. What didn't work? Getting in your own way, procrastinating, what?
Yeah, getting, just feeling confident enough that, I mean, sometimes I feel like maybe I'm not cut out for this. I don't know. It's hard.
No. So that imposter syndrome, it happens to me at random. I mean, at random times, and I don't sleep, and I'm like, and then I'll get up and look, I'm like, I don't know what that was all about.
Yeah. Yeah, meeting with you guys always makes me feel like I can do this.
Yeah, and that's why I love the life coaching, and that's why I wanted to have this type of stuff, is because we've all been there. I think it was Christy who had a period of time where she was like, I'm really struggling with this because I haven't seen it work. I'm peddling something that I haven't seen. It's like I'm selling a diet that I only see chunky people, like I haven't seen it work. And she's struggled. We all have, and you all will. Cindy and Aaron, you absolutely will, of like, who am I? Who am I to talk to so-and-so doctor about this, So, okay. I think that is does anybody else have anything to add? How can we support you?
I have a question, and that for like my next goal was to find a good continuing education course that will count towards dental but be myofunctional therapy heavy. And a lot of them are like, well, a lot of what I'm finding is like people want you to take their own course, like, oh, $2,500 here. But I was thinking you said Airway Circle was the one that you recommended because it has continuing ed and it's a good support group, or what have you found?
It wasn't me that said Airway Circle. And I don't know. I mean, I know that they have speakers and that kind of stuff. For me, so every other year I would go to a convention, and that's, I was doing, Collaboration Cures. And the reason I was doing Collaboration Cures is because that's the AAPMD, and that's doctors and dentists coming together to like break this barrier of the silo mentality, medical versus dental. So there's always a myo component. There's always sleep apnea, facial development, So that's where I would go. And the reason I went every 2 years is because my continuing ed cycle was every 2 years. So it's a business write-off. You get to go. I haven't gone, and the reason, it's just totally weird, but the last time I went, people were just weird, of like, oh my, you would have thought Kim Kardashian was walking in, and they made it so uncomfortable for me, of like, oh my God, I know you from the internet. And I just hid in my room. Like, it was just weird. I just ordered room service and wine to my room. So I haven't gone back. But that's a great place to start, because you will learn so much. Here's the thing, you guys, it will also put the biggest wind in your sails, because I can guarantee, based on what I've been to, I sat through those courses going, I already know this. I already know this. And I don't mean that in a derogatory way. I felt so good about the knowledge that I had procured for myself, that I wasn't taught, or how far I had come. So I was just like, oh my gosh, I loved the case studies. I loved, like, you will feel so proud of what you have learned. And, I'm proud of what I have taught you, because I have sat at tables next to other myofunctional therapists, and they're like flipping a coin, on something. And I'm like, oh my God, you don't know that, or like one gal asked me one day, how do you do an exam? You're seeing clients and you don't know how to do an exam. So it's just really, that was a long answer to your question. but Collaboration Cures is great. Just a sec, Rachel. Also, if you are a member of AAPMD, I think it's $200, maybe $200.
I think it's 250.
Is it 250?
I think so.
Okay. Yeah. Being a member of that, they do continuing ed courses like all the time, monthly. And if you're a member, you get the CE credits from that, but also if you're a member, then you get a discount on Collaboration Cures. So basically it was a wash. The discount that I got was equal to what it cost me to be a member of the AAPMD. And then I used to go to their courses all the time. I just have run out of time. I've gotten to the point where having a continuing ed class twice a week or every Monday from 7 to 9, like, no, I want my evenings. So does that help, Christy?
Yes, thank you.
Okay. Rachel, yes.
I was actually just going to say that the but I can't remember the acronym.
AAPMD.
Yes. That they do, if you're a member, you can do continuing ed courses. So I was debating on whether I wanted to spend the money. Sounds like it might be worth it.
Yeah, and they do great.
Whatever.
And if you're a member, you can go back into their archive and watch other courses. You're not going to get credit for it, but it's a great learning opportunity. And I think that's why when I went to conference and I was just really proud of myself, like I said, for my knowledge level, I always walked away with something that I learned. But I just felt like, wow, I have really leveled up my, what I know, or I could have that conversation, or I would have done this, or, that kind of stuff. Now I forget where I was going with that, but I learned so much from them, and I still have notes that I go back to all the time from them. So it's great. Cause you'll never know everything. Like just when you think, so, I mean, just like the whole posterior tongue tie thing. And now they've changed it to be there is no posterior tongue tie. I said that all along. Potato. It's the back of the tongue, back-ish part of the tongue. All right. Well, we did it, you guys. Yay. So this was good. So this is what it'll look like in the future. Just holding ourselves accountable. I hope that next time we'll all be a little bit better. Like, oh, these are my essential priorities. I know for me, that's a big thing because there is a difference between the to-do list and your essential priorities. And so really your to-do list, you guys, should be off of whatever one of those essential priorities are. Like if an essential priority is to have a website done, then the to-do list would be like, buy a domain, do this, all of that kind of stuff. So it just really helps you keep in line. Yes, Cindy.
So with the essential priorities, I'm trying to do the 6K in 90 days. So if I'm following that curriculum, it gives you, that's kind of how I'm going to set my essential priorities, correct? Okay.
Yeah, and you're going to have a lesson, like you'll learn about that in one of the lessons. But yeah, for you, like your priority is like, I'm following this plan, yeah. And everybody's just going to look different. That's why I said it's not always going to be revenue. It could be, I want to get out X amount of marketing. Now, as you go through the program, you can't only do my homework as a priority or else nothing else is getting done, because you have to be doing some sort of marketing. You have to be getting that website going. You have to be looking for providers. So there's a lot of parallel things going. So that's going to be like, yeah, this is the most important part, and I got to be doing this, and I got to be doing this.
And I don't know if I'll be able to do it in that time frame. I had big goals, but that's a lot. But that's what I'm shooting for. So, and then one other thing I wanted to say is, Christy, I know Dr. Hansen very well, and he is absolutely lovely. We send all of our patients to him as well. And so great choice on him. I worked at Santa Fe Dental 20 years ago, and he had just started. But great guy. So good choice. Yeah.
I'm checking my provider list to see.
May not be on there because he's not on the airway dentist Are these still going out? Do you still mail these out? Did they get,
Yeah.
are they getting these?
Yeah.
So I just found these like 2 months ago, cause when I got it all, I was moving. Anyways, staple your business card in the back if you have one, or write your information and keep it in your op. There's a bunch of different, but I love to hand people stuff. And like, when you feel kind of weird about talking about yourself in the dental chair, just send them out the door with one with your phone number on it or your email or whatever and I love these, and I'm like, I can't believe they fit in my cabinet for a year.
Yeah, nope. And that's why they come in your student kit. And then also, so again, in my year planning, one of my end of the year things is honestly, I do it at Black Friday because Black Friday always has sales, you guys. So if you're creating your own brochures, but because I create those to sell, you guys can always buy them from me. I want to update them because now clearly I want to update the tongue tie one about the posterior versus mid blade, that kind of stuff. But yes, great. And the reason they're designed that way, Christy, is so that you can staple a business card, you can put a sticker, whatever, like a return address label, have those printed and just put your information on it. So it's nice to hand information to people because they read and then they go, huh. Because not everybody, I don't know about you guys, but I don't like being sold to. I don't like being like at the chiropractor the other day, he wanted to offer me something for my knee surgery, that I'm recovering from. And I'm like, give me something to look at so I can go home and research it. Like, I'm not signing up for it right now, type of thing. So, yeah, I have Dr. Hansen on he's my only contact in Oklahoma.
Yeah.
So I love that. Okay. Well, everybody, I see a comment. Hold on. Chat. Oh, Rachel left. Okay. I was like, I don't want to miss anything. Okay. So I think this was a good one. I will be setting the dates. That is on my to-do list. So again, I'm hoping to do them just that first week of the quarter, but you never know what happens. But this is what it'll look like next time. So everybody have a fantastic weekend and I will see you next time.
Bye, you guys.
Bye. Oh, hey, Christy, wait, you
Okay.
don't go anywhere. I'm going to stop recording.